Hello, my name is Dr. Caroline Grady. I'm a physical therapist at Cornerstone PT. Today I want to talk to you about disc lesions in the spine, what they are, how they can happen, and what the recovery process looks like. It's something that a lot of people are familiar with as they've heard a lot of, oh, I have a bulging disc. Oh, I have a disc herniation. Those are some things that might come up on MRI reports. It also can come up in more common terms of a slip disc or other sort of disc issues. These can occur frequently in the spine, and a lot of times they can be either asymptomatic, where people do not feel any signs or symptoms with a disc lesion like that, and there's different degrees of how significant they can be and how permanent they can be. Okay, so one of the important things to keep in mind is that having a disc bulge or even a disc herniation does not indicate that you will require injection, surgery, or any further medical treatment in all cases. Sometimes it can be accompanied by spinal pain as well as pain into down the legs or into the butt region as well. So a few of the common symptoms that people associate with disc issues will be numbness and tingling down the leg or even down to the back of the hamstring, back of the thigh. Sometimes pain can also be worse with coughing or sneezing, as well as pain into the back. However, disc lesions, whether it's a disc bulge, which is essentially the center of the disc just kind of having increased pressure, a little bit of bulge in that circle, that can be something that, again, can be asymptomatic and a normal part of the aging spine. But also it can cause some discomfort and cause some pain. There's a disc bulge. There's also a disc herniation where a part of some of that inside of the disc comes out as well. That can put pressure into a different nerve root, and those typically are accompanied by more of the numbness and tingling down the leg, as well as disc sequestration is essentially a piece of that disc coming off of the rest of it. And that can be in the space that the nerve normally travels. Most of the time, conservative care is recommended in all of those situations to determine the extent to which the disc will heal itself, whether that piece of the disc starts to slowly degrade over time, or whether the other muscles and tissues and joints of the spine can actually help to support and better allow for movement in the absence of or in the presence of a disc issue at one level. So I think just because people see a disc lesion, whether it's a bulging disc or herniation on an MRI report, or they hear that, frequently people think that's something that is a death wish. It is something that you're going to have surgery to fix. And a lot of times, one, that can heal and it can actually go away over time. So just because you have one at one point, as that progresses, whether it's weeks, months, or years later, that can actually reduce over time, just like anything else heals. The muscles, the bones, the joints, discs also can heal. So that's kind of one really common misconception with that. And then two, frequently, even if you do have that on your report, it's not going to be something that causes a lot of the symptoms that you're experiencing. Some of the back pain that you might have or pain going down the leg could also be coming from other muscles, joints, and other regions in the spine that are definitely treatable through physical therapy, exercise, movement, and I think that's a really good place to start. So if you are experiencing any issues or concerned whether the disc is involved with any of the back pain that you're experiencing, or neck pain as well, if that could be higher up in the spine, please give us a call. We're happy to discuss all of that information and any findings that you do have in your initial evaluation. All right, thank you for your time, and we'll see you later.